Dr. Marcelo, good afternoon, and thank you so much for being here in the show, the Psyche and Human Body podcast. You are very welcome, and I'm very grateful for you.
Thank you very much. It's a pleasure for me to be here.
Dr. Marcelo, for those who don't know you, can you please tell us who is Dr. Marcelo and what do you do?
Yes. So I'm a 55-year-old Brazilian surgeon with a training in general surgery and trauma surgery. And so I dedicated my entire career to the academic world. So I've been engaged into a lot of research since forever. And I published more than 250 papers so far, 4 books, and like probably around 1,000 participations in international and national conferences. And in this last 2 years, I've been working in Abu Dhabi, here in UAE, as the division chair of trauma, critical care, and acute care surgery at Sheikh Shakhbud Medical City in Abu Dhabi.
Wonderful. That's very fascinating. Doctor, why did you choose this career path? I mean, why surgery in specific and trauma in a more narrow niche, let's say?
Yeah. So when I went to medical school in 1987, when I started medical school, I was thinking to be a pediatrician. But then I realized that I was getting a lot of influence of my own pediatrician because he was such a nice guy. And, always, every time, even being sick, going there with my mom was always such a pleasure because he was such a nice man. So he was like technically influencing me a lot because there was no other doctors in my family. But then when I got to medical school, right in the beginning, in the old times, everything was more open than nowadays. So we were allowed to go to the hospital by the first day just to be around and to look. And then I started looking at the people doing surgeries and stuff like that. I said, well, that's really nice. So then I decided to do surgery. So basically I can tell you that after 6 months of medical school, I was already decided to do surgery. And then I start to work as a volunteer in my free time with some professors of surgery of mine in the medical school, going with them to procedures and learning to scrub and to help them. And then it was kind of a natural thing after that. And then trauma surgery, I technically I have some more specialties that I'm board certified. I'm board certified in general surgery, trauma surgery, gastrointestinal surgery, and minimally invasive surgery, so laparoscopic surgery. But trauma, what excites me a lot about trauma is that there's no same days. Each of your days is going to be a different day. Each of your cases is going to be like a very different challenge case. And there's no patient exactly like the other. It's different than when you do like an elective procedure. Let's say you're a reconstructive surgeon. You're always going to be this kind of procedure, reconstructing surgeries. If you're a breast surgeon, you're only going to do breast surgery. But for trauma surgery, it's like a very wild specialty because you're going to see basically I can operate from the neck, thorax, abdomen, everything can shows up in the door and you have to be prepared. So it's a very challenge specialty. And yes, so that's why I decided to go for trauma.
Doctor, I think that you being as someone whose specialty is in trauma, you face like very different kind of cases every now and then, and not every case is similar to the other. And now my question is, does the medical school prepare you for what's out there in real life? In a sense, how did you get here? How can you alter your approach to, let's say, treating the patient from one case to the other if medical school, for example, didn't prepare you for all what's coming?
Yeah, so what medical schools try to do, they try to to give you as much as possible a wide variety of cases and scenarios that you're going to be technically exposed to. Nowadays, it's way more easy than when like 30 years ago, because 30 years ago we didn't have the simulation labs that they have it today, and where you can put the student in front of a mannequin and you make them practice for like many times until they achieve all the goals. But I think there's no better school than life. So that's why I tell my junior guys, the difference between you and me is that I've seen this stuff more than you have so far. And that's the meaning of experience. When you start to see a lot of different cases and so for so many different opportunities, you end up like with more high index of suspicious when you see something. That's why I tell the guys, listen, this is not in the book, but I have this kind of feeling that something's wrong here. But why? I say, I don't know. I cannot tell you why. But, when I'm trying to connect the dots here in this case, I can tell you that something's not going right, and we have to be more aware. And that's funny because I was just preparing a presentation to give at the American Association of Trauma Surgery this morning. And the topic is missing injuries, how to avoid it. And missing injuries, everything comes around at the end with, you have environment situations, you have personal situations, you have patient situations, and all of these three big things, they can make you to miss an injury that sometimes is even obvious for you, but sometimes when you see like a trauma patient have so many multiple injuries that, let's say a patient got an amputated arm, everybody immediately is going to look at the arm, and you tend to forget about the rest, like the abdomen, the thorax, and the other injuries that can be associated with that. So I think you have to be practicing. That's why I tell the young people, the medical students, you have to come to the hospital. There's no better school than being in the hospital every day, looking for different patients, looking for the medical history and clinical findings, and always consider the exams as a secondary tool. Because nowadays the new generation, they tend to everything they want to have an ultrasound, a CT scan, an MRI. And I say, guys, you need to examine the patient. You have to talk with the patient, because at least in trauma, more than half of the time, if you listen to the story, what happened to the trauma? Oh, I was driving with no seat belts and I hit a wall. I was driving 140 kilometers per hour. It was high energy, no seat belt. So immediately in my mind, the patient can have a brain injury. He can have a thoracic injury. So it's very easy to kind of figure out what can be happening to a patient if you pay attention to the story that people are going to tell you. So this is all very important.
So how do you, as a doctor, first start with the diagnosis process? For example, consider me as a medical student now, and you want to educate me on the procedures of a proper diagnosis, for cases for patients. So how do I start, for example?
Oh, I like if you're looking about specifically about trauma, trauma needs to be very straightforward. So you don't have the same time as you have in an elective practice when you sit with your patient and you stay like for half an hour talking. So in trauma, we try to be very objective. So first we have this what we call MIST. MIST means mechanism of trauma, type of injury, signs and symptoms, and treatment. So this missed history, we need to get it from people from the pre-hospital team. So they have to tell us what was the mechanism of injury. Oh, car, motorcycle accident with or without helmet, gunshot wound, multiple or single. So they're going to tell us the mechanism. They're going to tell us the injuries that the patient sustains. Then they're going to have to tell us about the treatment that was done in the pre-hospital setting. And then they're going to go to the treatment that the signs and symptoms. So patient was hypotensive, was tachycardic, was alert, was unconscious, and then the treatment provided. Then when you get to the hospital itself, to the trauma bay, then it's a different story. Then we're going to have to get a more detail about everything. So we're going to go for the ABCD. A stands for airway. We have to make sure the patient have an open airway so he can breathe. Letter B going to be for breathing. So we have to make sure the air is coming from the airway through the lungs. Letter C is going to go for circulation. So we have to check if the patient is hypotensive, tachycardic, if he's pale, if there's any sign of a lot of blood loss. Then G is going to be for disability. That's we're going to evaluate the neurological status of the patient. And then letter E, we're going to try to figure out about the environment where the trauma happens, and we have to expose the patient to make sure we don't miss any injuries. So it's a very systematic approach, and that's why I tell people, keep track on the very specific tools that we have to use to make good diagnosis for trauma patients. Don't go crazy. Don't start thinking like an internal medicine doctor with 100,000 different diagnoses. Straightforward. So car crash, no seat belts, head, thorax, pelvis. You have to try to understand what you have to look for. And we have to remember that most of the time for trauma patients, around 10% of our trauma patients are very, very sick patients. It means that these patients will not be able to tell you anything. They're not going to tell you how it happens. They're not going to tell you where it's hurting. They're not going to tell you previous medical history. Nowadays we're going to see patients who are 80 years old driving. Like when I went to medical school 30 years ago, it was very unlikely to see an 8 years old lady or gentleman driving a car. Nowadays, you see a lot of older people driving and doing like regular activities, riding bikes, so on and so forth. And this patient, they can carry with them a lot of previous clinical problems that can influence in our treatment. Like they can be hypertensive, diabetics, they can be taking like 10,000 different medications, and it's very important. So if they don't communicate with us, we have to keep in mind to try as soon as possible to find somebody from their families in order to be able to get some more information from them, because it might be like a very important thing to get information like, oh, my father or my grandfather is taking aspirin every day, because aspirin can increase the risk of bleeding. So very simple medication that can make our life like a nightmare regarding like a traumatic brain injury, for example. So it's very important to be paying attention to the small details, and that's where you get the good things about your patients, when you really pay attention to all the details, and then you say, okay, I got here. So this is going to be helpful for me. So yeah, it's interesting.
Like the small details would make a difference in like the correct diagnosis in a sense.
Oh, absolutely.
Doctor, let's start with the capstone. Like, what is trauma? Can we define trauma as a definition? What is it?
So trauma technically represents any kind of injury that can happen to a previous health person that's basically related to external source of violence, any kind. It can be a motorcycle accident, a fall from height, motor vehicle crash, gunshot wound, stab wound, explosion, burns. Everything related to this kind of situation is considered to be a trauma.
I see. And then, and at what point does the patient go to Dr. Marcelo? Like, are you the first, let's say, person who the patient sees, or would they have to be diagnosed first by someone else, then refer to you?
No. So the concept of a trauma surgery is exactly the doctor who is going to be able to manage like all the problems of a patient who sustained a traumatic injury. So we're going to be the first in line in the hospital to be admitting the patient, and we will be responsible to decide whoever needs to be join us in the care of the patient. Let's say a patient had a motorcycle accident and he had multiple fractures, he had an injury to the liver, he had a traumatic brain injury, and he also got burned because the motorcycle exploded. Let's say very bad patient. So patient comes to the hospital, to the emergency department. We're going to be, they activate the trauma alert. So we go immediately downstairs to the trauma bay. We see this patient. We try to identify if there is any potentially lethal injury for this patient in the first hour. If so, we have to take care of this. And then after that, we're going to say, okay, guys, so I'm going to need the orthopedic team involved. I'm going to need the neurosurgical team. I'm going to need the plastic surgeons involved. But we as trauma surgeons in a big trauma center, we should be the ones considered to be the trauma leaders. So we are the ones who invite other specialties to join us. The only distinct situations, let's say a patient arrives and we do the formal evaluation of the patient, and then we conclude that the only trauma that the patient sustains is a broken arm. So this patient is going to be, if in case there needs to be admitted, he will be admitted under orthopedic, and we kind of jump out of the case, because we already evaluate the patient. And even though this patient, they still going to have us for one more evaluation that usually happen one day after admission. That's we call the tertiary survey. So we go back to the patient to make sure we don't miss anything. So after that, the patient belongs to the orthopedic team. But usually when the patient has more than two systems, like say a broken arm, but also a mild traumatic brain injury, this patient stays under trauma. So we manage the macro, and the specialties they're gonna manage the micro situation, like the bone or the brain. But we as a trauma surgeon, we're gonna always be looking for the whole patient in a more holistic approach.
I see. Doctor, I'm assuming that you also practiced your specialty back in Brazil. So my next question is, have you noticed that the environment plays a role in the kind of patients which come to you to the trauma department? Like, would the environment plays a role in how, let's say, the patients are having accidents, in a sense? Have you faced
Yes.
different cases between here and Brazil?
Oh, totally different. Like here, uh, I can tell you that I've been here for 2 years, and like 90 something percent of the trauma patients that we see in the hospital are related to blunt trauma. So
Oh,
motor vehicle accidents, motorcycle accidents, and fall from height. These are the three main causes of admissions in UAE. If you go to South America or to United States, you're going to see an average of 50-50 between blunt trauma and penetrating injuries. So in
mm,
Brazil, we used to see a lot of stab wounds, gunshot wounds, so more violence-related problems comparing to the Middle East and the UAE specifically. So here we don't have, I haven't seen not a single case of gunshot wound in 2 years. In Brazil, that was very hard for me to spend a week without seeing at least three or four. And some days, I remember some days like Fridays nights or Saturday nights, where they get like a big party and a big fight, get like
mm.
5, 6, 10 patients with gunshot wounds at the same time. So it's totally different. So the environment plays a very big role in this kind of situation. Same in Europe. In Europe, most of the traumas are related to blunt trauma, and in Africa, the same. A lot of trauma related to motor vehicle accidents, but with a very high mortality rate because of the situation of the African continent. So this also play a big role in the results because the hospitals are not very well equipped, the teams are not very well trained, and for this reason, if you compare the data, we have some scores to get the patients in a kind of a same level of severity. So let's say patient have a traumatic score of 15.
Mhm.
This patient in US will have a rate of death of around 10%. Goes to Africa, it goes up to 45. Same
Oh,
patients, same traumatic injuries, but just changing the environment and the hospitals and training teams and so on and so forth, it can play a really important role. So this is very interesting to see.
actually, that's something that I never thought of, but now that you brought it to light, I think like how the country or the medical system in the country is prepared to treat certain cases also plays a role in the mortality rate of certain cases, which is something I'm pretty sure that most of the people don't even think about.
Yeah.
Uh, yeah,
No, it's
Doctor.
it's really important. Yes.
Doctor, you mentioned at the beginning of the conversation that you're amidst some research. Can you please tell us about what kind of research are you doing?
Yeah. So the first, like the more like the strongest research in UAE specifically now for me, we are trying to understand the how does the trauma system works in UAE. So we are trying to help the UAE government in a partnership with the U.S. Military defense personnel who are working with me here in the hospital, try to establish a trauma system, especially for Abu Dhabi. Other than that, we start to get the data, we collect the data from our last 2 or 3 years to understand the most frequent mechanisms of trauma. And on top of that, we can try to work in a prevention program. So we know already that it's still unfortunate a lot of people in UAE that don't wear seatbelts, especially in the back seats of the cars. We know that a lot of children don't wear seatbelts inside of the cars. What else? We know that one of the major cause of admissions in hospitals here in UAE is fall from height. Then we have to understand what's happening here. Is this related to a lack of use of personal equipment? That doesn't seem to
Mhm.
have because the law exists already. But maybe because sometimes you have the law, but people don't follow the rule. Like let's say the construction site provides for the employee all this, the equipment, but then the guy doesn't use it or use it in a wrong way. A lot of things can influence these numbers. Another thing that's interesting to see is depending on the period of the year, you see a higher rate of suicide attempts.
Oh,
So this is always interesting to see, and I can tell you that really calls my attention. A couple months ago, like 3 or 4 months ago, I remember in 2 weeks I had 4 people trying to cut their throat in the hospital. one after the other. In 4 weeks, I had like a sequence of 4 or 5 patients coming exactly the same pattern of injuries. So, this is important research, because this is something new for the country, talking about trauma and developing a trauma system, a trauma hospital, a trauma team. So we need to get this kind of profile. On top of that, I still have a lot of engagement related to research in US and Brazil. So I still have my students from PhD and master in Brazil. They're doing a lot of research there. And so I still get engaged with them. And every week we have meetings and we discuss the results. So I try to keep myself busy academically, because if you don't do that, people forget about you. So you have to be really careful to be in evidence and keep up publishing, so on and so forth.
Doctor, talking about establishing a good trauma system now, so the obvious question is, how can we establish a good trauma system where we can diagnose the problems that are happening in the country or in our environment? How can we avoid them, and how can we solve them, for example, when we are facing them? In other words, how can we prevent trauma for the future?
Yeah. So my personal perspective is that trauma will unfortunately will never end. That's one point. We're always going to have trauma. What we're going to see is a decreased number of severity, because the cars, for example, are getting safer and safer. But again, there's no safety profile in the car that can save your life if you're driving up for 160 kilometers per hour without seatbelt. You're going to die anyway. You can be in a Ferrari, you can be in a Maserati, you can be in the best car in the world. You can be in a Volvo that's considered one of the most safe cars in the world. If you're not wearing seatbelts, you're going to die. So, but I still think we're going to have some room for improvement. So the cars are getting safer and safer. Then what I think in the future is going to happen, we're going to start to see less trauma, but more severe traumas. Because the ones who are going to be needing to go to the hospital will be the ones that are not using the safe equipment that the cars can provide you. We're going to always have motorcycle accidents. And for motorcycles, it's really hard to understand what can we do other than ask the drivers to use a helmet. But again, the helmet doesn't make miracles. Helmet can help you if you drive a motorcycle by like 40 or 60 kilometers per hour and you fall. But then if you fall in 160 kilometers per hour, there's no helmet, your head can just be cut it off. So,
Yeah.
we're always going to have this. So I think making people understand that we have to follow the rules that already exist, and the rules are there because people already proved that you have a safe speed limit, you have to wear a seatbelt, you have to have airbags in your car. So you have to try to follow this. I think we're going to start to see less and less trauma in the future in places like in the Americas, South America, Central America, and North America. The only solution will be to have less guns. So gun violence is a major issue in US and Brazil and Colombia and so forth. So we have to have more very stricted rules for people to carry guns, because if you don't do that, we're not going to see the numbers going down. So we hopefully, inshallah, in one day in the future, we're going to only see, I hope not, but in the war situation, gunshot wounds, for example. We shouldn't be, seeing patients being killed every day all over the world because people are using guns to shoot each other. This is totally preventable. How we can prevent that? Just tell people that is not allowed. Make a very strict law and say, if you carry a gun, you go to jail. And then I guarantee you that people are going to be thinking twice before they go, to the bookstore and carry a gun. It's like totally crazy.
Yeah.
And regarding a trauma systems means to develop infrastructure in the country that allows you to, by the time you recognize a trauma situation, this patient needs to be seen by the pre-hospital trained team, be taken to the best hospital that can provide the best care in the fastest way. It means that we need to be prepared to recognize fast, get a mechanism to call the authorities and say, okay, I just passed through a very bad car accident in a big road going from Dubai to Abu Dhabi. I saw there were like 3 cars and somebody needs to get here. Who is going to be going there? So this is a trauma system. So activation from the central going to say, okay, I have ambulance. They're like 10 minutes away. So I will send this ambulance. By the time the ambulance gets there, they might say, okay, we need a helicopter here because the patient is in really bad shape. This is also trauma system. And by the time everybody's in the scene, the hospital who should be taking care of this patient need to be aware of this accident. So the central is going to call the hospital and say, listen, we have a car accident with 5 victims, and they're going to be expected to arrive in 45 minutes in your hospital. So sometimes the best hospital is not the closest one. And this is also trauma system. The central needs to know that they might have a hospital 10 minutes away, but they don't have trauma surgeons there. They need to know that. Because the way it happens today, most of the traumas, they end up going to the closest hospital. And this doesn't make sense because sometimes the closest hospital is a maternity. So they have doctors there, but obstetrician doctors. They're not trained to take care of trauma. So this is all trauma system. Who's going to get to the accident? Who's going to take this guy from the accident to the hospital? Which is the best hospital to be? And how are we going to make this movement among the hospitals in the country to identify which are the best hospitals to take care of patients in Dubai, in Abu Dhabi, in Sharjah, in Ras Al Khaimah, so on and so forth. This is the meaning of trauma center. In a place like UAE, we can have probably 1 or 2 big trauma centers for the whole country to take care of the really bad traumas, because it's a country that you can fly by helicopter very fastly. It's different than Sao Paulo, where I used to live. In Sao Paulo, we used to have 20 million people and at least, 10 trauma centers in the city. So, helicopters was usually like in daily base because the traffic was so bad that if you have to rely on the ambulance to drive around, your patient's going to be dying during transportation. Yeah. So even for short transportation time, sometimes we require the helicopters to do that because we know nowadays. I used to work in the pre-hospital system like 20 years ago, but nowadays they know that they can take a patient from any point of the city to a major trauma center in less than 5 minutes flying. So this is a good trauma system because the patient goes very fast to the hospital and goes to the right hospital. And if it's a minor trauma, the guys, they know that they're not going to take to a major trauma center because major trauma center needs to take care of bad patients. They can take to a secondary level patient hospital where they can have let's say the guy fell from a motorcycle and have a broken knee. That's the only thing that the pre-hospital identify. They call the center and they're going to say, listen, patient's totally stable. The only problem is a broken knee. The guy there usually is a doctor is going to say, listen, don't take this patient to the trauma center. Please take this patient to whoever hospital that's close to you guys, because I know that in that hospital they have orthopedic team that can take care of this trauma. So this is a good trauma system. So we try to, that's what I feel here in our hospital. We technically are like one of the biggest hospitals in UAE, but we still receive a lot of minor injuries here. And then every now and then I heard that, they receive a very bad trauma in the CCAD in Cleveland. Cleveland doesn't have trauma. They shouldn't receive a bad trauma there. So, so this is a trauma system that needs to be developed with the ambulance team, like police officers. Everybody needs to be involved and define who is going to be responsible to do all this distribution inside of the country and inside of Abu Dhabi in order to offer our patients the fastest way to being the best trauma center in the country.
Very beautiful. It seems like an ecosystem where everyone is involved, from the police department to the hospitals, the doctors, even the doctors who are in certain hospitals. They need to be aware of who's the most suitable doctor to be referred to certain cases. So it's like everyone has to be aligned with the medical system and for the referral as well. That's very beautiful.
Right. That's right. Yeah.
Doctor, like something that crossed my mind while you were talking, and which is, why do you think that humans usually tend to self-destruct in a sense? For example, they are self-aware of the penalties and the dangers of driving without the seatbelt and risking their lives. Why do you think we still do it?
That's a good question. Well, man, if we look at the numbers, one thing is gonna be very clear. Doesn't matter where in the world, is that the vast majority of trauma patients are people less than 40 years old. So maybe life experience and maturity can play a role in the trauma itself as a major thing. Number two, the vast majority of trauma patients are males. And this has to be with this inconsequence that we, the men, have regarding behavior. Like we are more competitive. We like to win. We like to get these adrenaline shots, driving like crazy. Things that usually the women don't care. They don't care. They don't want to drive fast. They don't want to go crazy in a car. They don't want to get a gun to shoot in a shooting place. This is kind of thing that usually for women are not fun, and for men are very fun. Men are very. I think it's from the human nature. Uh, this comes from thousands of years behind, where we used to be very competitive, trying to hunt for food, and even killing each other to dispute this piece of meat or this animal you just hunted. So I think it's kind of inside of human nature to be competitive and to get this excitement of new things, and like speed, and drive like crazy. So and most of this time, who gets in trouble are the men. Men are very
Mm.
stupid when they do all these crazy things. Like why were driving 160? Oh, you should see, doctor, it's so nice, my brand new car. I was going crazy. That gives me such a great sensation. Yeah, congratulations, now you're all broken, you're going to stay in the hospital for a month. So I think this is really related to that. Of course, there's some stupidity related to violence and poverty, and this is like the social part of the trauma system. If you look at the highest numbers of traumas in the world, they are all basically all situated in low income countries where the social disparities are very high. So every time you
Mm.
have less education, higher poverty index, people dying because they don't have food, they don't have education, and they don't have a chance to grow in life, that's where you're going to see the gangs, the drug problems, and the violence. And this is all related to higher index of trauma. So people shoot each other for nothing. Like unfortunately in Brazil nowadays, if you want to have a nice car and drive around with your Rolex, you have to have a bulletproof car. Otherwise, they're going to shoot you in the head just to get your wallet or a watch. This is the
Oh,
level of craziness. So this is one of the reasons why I decided to leave the country. I said, no, I cannot sustain like this. You have to work. And unfortunately, the truth is that most of the big trauma centers in Brazil are located in very poor areas for obvious reasons.
mm.
That's where the violence happened. That's where the gunshots are happening. So you have to drive to your job every day in the morning. You have to leave in the night. And if you don't have a bulletproof car, they're gonna stop you. They're gonna hurt you. And but even though it's funny, because after I used to work in a very busy trauma center for like 10 years. That was like in the middle of one of the favelas in Brazil. And seriously, after 10 years, even the bad guys, they knew me already. They
Oh,
knew because I've treated a couple of them, because gunshots and stab wounds. And I remember one day, they like 3 o'clock in the morning, going back home, and somebody just appeared in front of me doing like stop with a gun. I said, oh my God. I wasn't a bulletproof, but still I had to stop it because I would hit the car. Then the guy looked at
yeah.
me. Oh, I know you. Go, go, go. So probably one of the guys that I treated, he looked inside of the car. He saw, I know you. You can go. I said, okay, thank you, thank you.
Well, good that you know me.
That's fun, but it's really because the numbers were so crazy in that area. I remember a couple of patients that I treated in 10 years, like 3, 4 times. Gunshot goes from the discharge from the hospital. For 1 year, shows up again, stab wound. Say, man, what are you doing? Oh, I have problem with the other gang, so they hit me. So it's crazy. It's really like the gang fights and everything is really crazy.
Wow, you only hear about that in the movies, but now listening
Yeah,
to it on a real life, it seems
yeah, it
different.
is. It is. Yep.
Doctor, let's talk about the seat belts and its importance with children. How do you think us as parents should we care for the children when it comes to seat belts and properly using them?
Okay, so I will make a statement here that is kind of strong, but it's really what I think. I think every car crash, when you have an injured child that was not wearing seatbelts, the parents should be sued by law and be considered to be guilty. Because I cannot understand how a father or a mother can let their child get inside of the car and do not use a seatbelt. This is a crime. This is totally unacceptable. Why should you wear your seatbelt and leave your 4-year-old kid jumping in the back seat until you get a car crash and you see your poor child just being ejected from the car, end up with a traumatic brain injury, severe spine injury, and maybe not being able to walk for the rest of their lives? This is totally unfair. So I can tell you that, seat belts, they were built to be used by everybody. If you have a small
Mm.
child, there are specific seats, car seats that can be adapted to your car, but every single child inside the car needs to be wearing seatbelts. Sometimes I go crazy here. I see people open their rooftop in the car, and you see
Yes.
the child like, driving the road, and the 2, 3 kids outside looking at the road. Geez, how can you do that? If these people get in a car crash and get like roll over, these kids are going to be immediately dead. So not wearing seatbelts for children inside of cars, it's a crime, and it should be treated like one. I don't care if it's a mother or it's a father. Recently, unfortunately, we got a situation like this when car crash, bad injury to the father, bad injury to the mother, and the child end up dying.
Oh,
This is a
yeah.
really bad situation. It's a really bad. So who's going to be blamed? Whose fault was this? I'm sorry. I know it's a sad situation, but in my personal opinion, the fault is from both father and mother.
Mm.
Because my kids are now grown, but I remember when they were young, there was no way we could even start the car without they put their seatbelts on. And there was no way they would just release the seatbelt because they were playing inside. No, no. If you're inside the car, you have to remain seated with seatbelts. It's essential. It's really essential for the safety of the kids.
Doctor, after all these years in this field, would you do it again? Would you go again to the trauma school and the surgery medical system, let's say? Would you do it
Oh
again?
yeah, yes, absolutely. So I'm a totally passionate for what I do. I love what I do. I really like. I really love it. I couldn't see myself doing anything other than that. Actually, that's how I tell my wife. My wife is a lawyer. I tell her, I don't do anything else in my life. I don't know how to do it. The only thing I know how to do is like to cut people, put people back together. You know, that's what I need to. That's what I like to do. That's what I do every day. That's what I love to do. So, like, I'm so workaholic that I don't remember in 32 years after I graduated when was the last time that I took like 2 weeks off as a
Mm.
vacation. I usually still like you say 1 week, and I say, okay, I got to go back to the hospital. It's enough for me. It's too much. So, and my wife say, you crazy? I said, no, I can't. I can't. I need to go there. I need to see patients. I need to see. I love it. So it's really like a big passion in my life is to do what I do, and that's why I tell people when you find something that you like to do, you don't have to work one single day of your life.
Yeah.
Because for me, like coming to the hospital is like such a pleasure that it's my fun time. It's my time where I have my friends and my patients and the beautiful histories and the sad histories as well. And this, I think this teaches a lot when you learn from the bad side. And that's what gives you experience when you were exposed to so many different situations and so many different people from all over the world. And so I think it's a very nice specialty. Surgery in general is very nice. It's very challenged. There's a very high motivated thing because it's not always the same story. But trauma is a very dynamic thing. It's very exciting, and you're always learning something new. And I tell my junior people, if you go to bed one day and you don't learn anything new, you better stay awake and go try to learn
Mm.
something. That's why I come to the hospital 5:30 in the morning every day. I read like one or two papers before I start working, and I send to everybody with the yellow marks. I say, guys, I don't want to push hard for you. Just read the yellow marks, and you're going to learn some new stuff today. And that's
Yeah.
what I do. And yeah,
Fascinating. I think that this is like a magical thing in life where we are like beautiful by our different individualities. Because some people might feel like treating trauma and surgeries is not something for them. And for others, like you, it's something that fulfills you. And from that, we can, let's say, expand and measure all the other humans. Like everyone has like something which they are passionate about. And I think this is what makes the human, let's say, society like fascinating in a sense.
that's right.
Doctor, is there anything that you'd like to share before we close up the episode? Anything that I didn't talk about that you want to talk about before we finish this?
No, I just want to remember people to be careful. I mean, most of the people who are dying from trauma are young people. If they don't die, they might end up with very severe disability for the rest of their lives. And just to give you a highlight, trauma nowadays kills more people in the world than HIV, tuberculosis, and malaria together, for example. So we talk about, oh, HIV is a problem, oh, malaria in Africa is a problem, but guys, there are more people dying every day because of trauma than all these three diseases together. So, unfortunately, trauma doesn't bring votes for the politicians, and that's why people don't talk about trauma in the regular media in the frequency that should be talking to, because it doesn't bring votes. What brings a vote for a politician is to build a beautiful hospital to treat cancer. But nobody wants to talk about trauma, because trauma represents for the politicians the fail of the system. You're failing because you're not providing good laws to inhibit people to get guns. You're failing because you're not putting the laws to work to avoid people to drive on 160 or 180 kilometers per hour. You're failing because you're not telling the parents that if a child gets dead by a car accident, they will go to jail, or if a child gets burned because you just left some boiled water on top of your kitchen and accidentally she drops over herself, you will be guilty. So trauma doesn't bring votes. So, but be aware, trauma kills like more than 5 million people per year. And unfortunately, I can tell that at least half of this could be preventable. So be careful, use seatbelts, follow the rules, don't drive like crazy, don't drink and drive. Don't drink and drive. Drink and drive doesn't work well. Don't carry guns. Don't play with guns. Don't stimulate your kids to play with guns. And yeah, that's it. And unfortunately, we're still going to have traumas, even with all this advice. But I think as if each of us can play and do our little part in the community, we can see the numbers going lower, and then we can maybe prevent some people to get that. That's it.
Dr. Marcelo, thank you so much for being so kind to share your information with us today. I very much appreciate you and wish you nothing but the best. Thank you so much.
Thank you very much for the opportunity. It was great to be talking to you, and we keep in touch. Bye-bye.
Bye-bye. Ciao.